Wonder, Wonder Woman. Oh, Superwoman in the building. We on fire, fire.
We did it, guys.
Wonder, Wonder Woman.
You got to go to med school, have a business degree, you know, give birth to 10 children to figure out how to Zoom and screen share. But we did it. You guys can't see me, and I'm not going to flip-flop because I don't want this not to work out. So welcome to Gut Over It, everyone. I hope you all can hear me. I hope you can see my screen. I am going to be trying to look on the side to make sure that everyone is able to ask questions. Hold on, hold on. I got messages coming through. Let me just double check. Yes. Can you hear me? I hope so. I hope so. Well, tonight we are going to be talking about hiatal hernias, but let me introduce myself one more time. For those who don't know me, I am Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. And I am also a functional medicine provider. And this is Gut Over It. And this month, in the month of February, I set a personal challenge to talk about a GI topic every night. And the focus of this topic is really to help you guys understand out there as people who just may have gut symptoms, what's important to share with your gastro doctor or your primary care doctor, what you shouldn't be shy about sharing, and the questions that you must ask, because this could lead to gut relief and symptom relief. And this was a popular demand, and everyone wanted to hear about hiatal hernias. So sorry we're a little bit late. I was working with my partner in crime, Michelle, to figure out how to get this screening thing working. I almost gave up, but she hung in there. She hung in there with me, and we're glad you guys could make it. And I think once we got this going, we're good. We're good. We're going to be able to do a lot of stuff. So let's talk about hiatal hernias. Hiatal hernias usually sit right in that epigastric area. And let's see, there we go. Nice. So they usually sit right in that. This is really where the diaphragm is. And this is the food pipe. This is the stomach. Okay. And the diaphragm kind of pinches right at the end of the food pipe so that things close up when food goes down. Right. But a hiatal hernia, there's several different types of hiatal hernia. The ones we commonly see are the type 1s and the type 2s, where a little bit of your stomach actually herniates up above the diaphragm, which is right under the chest, like right into that xiphoid process. And that means this little sphincter here, or that little trapdoor, does not close very well. And when you eat, it's almost like you've got a second stomach right there. And food does what? Reflux. Or it stretches this area out and you get that chest pain, that real discomfort, or it causes you to belch excessively because it's almost like you have food stuck at the end of your food pipe. So this is type 1 hiatal hernia. Type 2 is the one that kind of slides and stays at the side. This one slides up and down. So this one will get worse if you gain weight or if you're pregnant, right? And it just kind of slides up above the diaphragm because there's abdominal pressure. This one stays on the side. This is the one that causes even sometimes chest pain and discomfort, right? This is a larger one where most of the stomach is up there. And then this is type 4, where a lot of the stomach comes all the way up, right? Dragging even sometimes small bowel with it. And this one definitely requires surgery, because what can happen is that this extra stomach that actually sits in your heart can twist, what we call a volvulus, and the mucosa, the gastric lining, can actually just become necrotic and die. So that is really important. This is what we see when we do endoscopy in terms of the different types of hiatal hernia. So when we do endoscopy, we can see that a little bit of your stomach. So this is an upside down look at the stomach, at the GE junction where the food pipe meets the stomach. So this is the stomach, and that's right that junction where you see the small hernia you really have to see this in live motion, because you'll see the stomach just rolling in, rolling in, rolling in. This is type 2, where it's more on the side, type 3, and this is the very large one where a lot of the stomach is up there, okay, up in the GI tract. So, well, before we even go on to different surgeries for the hiatal hernia, I want to go back to symptoms for hiatal hernia. So I'm glad to see so many people online. This is fantastic. I hope everyone is enjoying this. If you please go ahead and give it a like, share some love, leave a comment, or just leave some likes. Share this with someone who you know has hiatal hernia. All right. And just keep on listening, because I'm going to share a lot of information, but I'm going to take a little 10-second music break just to pump myself up, okay? Here we go. It's like a music, it's like a pause, halftime. This is Dr. V's halftime. You can't see me, but I'm definitely dancing. Okay, let's get back to it. So there are many symptoms you can have when you have a hiatal hernia. Most common ones: belching, tightness in that area after you eat, pain in that area, heartburn, reflux, and of course, I'm talking about the average small hernia, the Hill type 1 or Hill type 2, okay? Now, some people have hernias, but they never have symptoms from it, right? They have hernias. Hernias are actually quite common. And a lot of people may have hernias, but never have symptoms from it. And the size of your hernia doesn't always necessarily reflect the degree of symptoms or the severity of symptoms. Some small hernias can cause a lot of chest pain and discomfort and spasm. Some people have large hernias. I'm surprised, maybe 5-centimeter hernias. And they're like, I'm fine. I don't even have, maybe a little mild reflux, but nothing significant. Now, one of the biggest concerns with hernias, one, of course, are the symptoms. But the second issue is that if part of your stomach is actually sitting in the chest, and you keep refluxing into the food pipe out into the mouth, because you've literally got food sitting in your chest, this food can go into the lungs and cause what we call aspiration. And this aspiration of gastric acidic contents into the lungs can cause a pneumonitis. Okay, so this is one of the major complications or issues with hiatal hernias that's very scary. And that's why in some situations, just aside of the pain and the belching and the symptoms it causes, we want to make sure we fix this, right? And we're especially concerned about aspiration in people who are older, right? In people who have asthma or underlying lung disease, because we don't want the acid to cause pneumonia and make this worse. And so when it comes to that point where we have to make a decision about surgery, we then talk about, well, what are the different options? Who can get surgery? Who doesn't need to get surgery? What are the different options for hiatal hernia repair? And the most common one is a Nissen fundoplication. Now, this isn't done by gastroenterologists. This is done by surgeons. I generally like to refer to four gut surgeons. So these are surgeons who do just this, right? These are surgeons who repair the esophagus, repair the stomach. They're extremely good at what they do. And they basically take that excess tissue of the stomach and wrap it around the food pipe to keep everything nice and tight so that you're not refluxing anymore, right? So this is a major surgery. This is not a small surgery. It's done laparoscopically, so you get the 3 little holes. And sometimes this fix, I would say 90% of the time, this fixes the issue very well, where you no longer have to take the acid blocker medication, the pantoprazole, the omeprazole, and we don't want patients taking this for too long. So when patients are able to get off this, they are extremely, extremely happy. So when would your GI doc recommend that you get this kind of surgery? Guys, again, if you are enjoying this topic on hiatal hernia, have a hiatal hernia, and just want to learn more, go ahead and like this page, like this video, share some love, or leave in a comment, hiatal hernia. All right, so we know that was the topic of tonight. And if you guys have any questions at all, please post them on Facebook as comments, and I will try and answer as many as I can. So you have, you have a hiatal hernia, right? And so you got an endoscopy. That's one way to detect it. We can also detect through barium swallow, which is a radiology test. And your GI doc says, hey, you've got this hiatal hernia, it's 3 centimeters. It's 1 to 2 centimeters is small. I would say about 3 to 4 is medium size. Anything greater than 4 to 5 is a large hernia, right? So he says it's small. They say it's small, and they recommend, you have 2 options. One, you can take your acid blocker medication like your omeprazole or your pantoprazole for forever. And we'll talk about why that's not a great idea. Or 2, we can consider surgery, right? And even before surgery, there's going to be a couple tests to do, but this is one of the options. And they will refer you to a surgeon to first make sure there are no other causes of your symptoms and that it's the hernia alone. So this is the Nissen fundoplication. For people who have, now this looks like a beautiful bracelet or a ring made of titanium. This is the Lynx ring. And this is a procedure that came out not too long ago, maybe about 7-10 years ago. And this is for people who have small hernias or no hernias that have a lot of reflux symptoms. And so if you look at this ring, what they do is they actually surgically, again, this is done by surgeons, they go in and they put this ring at that end of the food pipe, where we kind of mentioned where the stomach, right over here, if you all can see. And the ring is almost like those elastic bracelets. Remember those we had as little girls, the colorful ones? So the ring is elastic. So when you eat, it stretches out and food can go down. And when the food is gone into the stomach, right over here, the ring kind of constricts and keeps things closed so your hernia doesn't herniate and the reflux doesn't happen. I mean, that's the biggest thing, right? We just don't want that reflux happening. This procedure is called the TIF procedure. It's a different kind of procedure, not necessarily just for hiatal hernias, not so much just for the hiatal hernias, but to help that valve stay closed if you have reflux disease, okay? So it's an endoscopic procedure done by people who are trained. And what it does is you kind of like staple in this area and strengthen this valve, right, at that GE junction so that it stays, it fastens it. You kind of put fasteners to keep that valve tight and stop any kind of herniation from occurring. Another procedure is called the Stretta procedure, where you actually put a balloon to infiltrate and inflate right at that food pipe. The balloon has electrodes in it. You apply some radio frequency and it kind of like causes a little scarring, fibrous tissue, and tightens this junction. So this is more so just for people with reflux who don't necessarily have a hernia, but these are all great options for surgery, okay? And so we've talked about surgical options for the hiatal hernia. Again, I'm gonna go back one slide because I wanna talk about lifestyle. I don't wanna miss lifestyle because there's a lot we can do. As I said, not all hernias, actually, most hernias don't require surgery, okay? We talked about high-risk patients who have aspiration pneumonia or asthma who will aspirate acidic stuff, but a lot of us who have small hernias can manage it with just a change in our lifestyle. So losing weight, because even when you gain about 5 pounds, this hernia becomes a problem, right? The abdominal pressure pushes on the diaphragm and everything pushes the stomach upwards. So losing weight is a big one. Eating small amounts at a time and not overfilling the stomach so that this hernia sac gets full, okay? And of course, just regular things you would do, elevating the head of the bed before bedtime, to 45 degrees. Make sure you're not eating late at night, because if you do eat it late at night, imagine if you have this hernia and you're laying recumbent, where is the food gonna sit? Right in that hernial sac. And that's when you can't sleep at night because you're so uncomfortable, okay? So making sure you're doing those lifestyle things, avoiding spicy foods, etc., to make sure everything goes well, okay? So we talked about all the surgeries, and let us talk about some maneuvers that are out there to help with, releasing hernias, especially when it really hurts. This is non-surgical approach, right? There are lots of maneuvers out there where you could drink some water right? Stand up, lift your arms out, you know, bend your elbows so your hands touch your chest, rising up and down on your toes, just to kind of stretch that diaphragm, stretch the abdomen, and release the hernia down. So there are many different kinds of poses you can do, you can find online to help relieve hernias. And we know a lot of patients will say that this does work. It works very nicely. It does work, but it's short-term relief, not long-term relief. Self-massaging, laying on your back and just putting the fingers in that breastbone. You can find a lot of great videos on YouTube. But again, these are mechanisms for temporary relief, okay? So these are all options we looked at. So I'm gonna try and stop the screen share and see if I come back live on Facebook. Let me double check if I'm live and if there are any major questions. And if there aren't, let me check if there are any major questions. If there are not any major questions, you know, I'm going to play a little bit of music one more time while I check for questions, okay? Hold on. Oh, superwoman in the building, we on fire, fire. Raise your hands if you are not sugar, and you know say you are getting on fire. Hey, keep your mind if you are not sugar, and you know say you are getting on fire. All right. We have a couple questions. I'm going to go through those really quickly now that I've had my little break. So if there's belching with hernia, absolutely. There can be a lot of belching with hernia because what happens is that that little air bubble sits in that little second stomach that's in your chest, and that can create a lot of belching. So keep in mind, small amounts throughout the day. Don't overeat. Stay away from carbonated beverages. Sodas and stuff will cause a lot more belching, right? So we don't want that. That's going to cause a lot more belching. It can definitely also cause a lot of discomfort and pain, okay? Hernias can hurt. Hernias can cause quite a bit of chest pain, and I'll tell you why. It's because remember the pictures? Yes. The food pipe comes down, is right at the diaphragm, and there's some nerves that actually run along that to the diaphragm called the vagus nerve and the phrenic nerves. And so there can be a lot of nerve stimulation when there's a stretch in that hernia. It can impinge on the nerves and definitely cause pain, definitely cause a lot of chest pain, okay? And so if any of you guys have had surgery for hernias, hiatal hernias, you know that it can go extremely well where you get off all those acid blocker medications that can cause long-term side effects. And we'll talk about that in a different video. But for the most part, when it works, it's very successful. Our patients are don't need any kind of PPI for at least 5 years. But as a gastroenterologist who's been in practice for over 10 years, I certainly see that wrap, the Nissan fundoplication wrap that can be done, can unravel. It can unravel because the body, as I said, does its own thing. And over time, we wonder whether it's a laxity in the tissue or whether it's someone gaining weight over time. But when it unravels, patients know right away. They have hernia symptoms, they feel bad, and they need surgery again. Sometimes 2 times, sometimes 3 times. But if you're young, it's definitely worth it. So I hope I was able to answer a lot of your questions about hernias tonight, guys. I want to take a minute to thank you guys for listening, for sharing this page with others. I'm going to perfect this whole screen sharing thing, so bear with me. I also want to thank the 3 guys who helped me pull my car to the side because I had no gas left in my car. I was trying to wing it to make it gut over it on time. And as I left work, my car just stopped. I ran out of gas, believe it or not. That has never happened to me in my life, ever. But I ran out of gas, but there were 3 wonderful guys in Katy who came to my aid, helped me pull my car over. Mr. Malik, thank you so very much. You made my night. You also made my husband's night because he didn't have to come out there and get me. So thank you very, very much. Y'all have a wonderful evening. We will be on tomorrow night, 9 o'clock, rain or shine. Forgot over it. Have a wonderful evening, guys. Bye-bye.